test you'll probably learn with the knee. It's known as pivot shift test. A lot of the surgeons will use this maneuver when the patient's under anesthesia. This is very difficult to elicit a positive finding because most patients that have an unstable knee will guard. They don't like this. Because what you're doing is you're going to be reproducing the subluxation phenomenon that occurs when the ACL is torn. Okay? So this is the pivot shift maneuver, and I think it's a really good explanation in your text. And the pivot shift maneuver is used if you suspect an anterolateral instability. 776. Okay? There's a picture at the bottom that shows the phenomenon that occurs, and this really is created by the iliotibial band. This is a dynamic test. Now, if you think back to biomechanics, the iliotibial band, when the knee is in extension, does the iliotibial band lie anterior or posterior to the joint axis when the knee is in full extension? Anterior. Okay? When the knee assumes about a 30-degree knee flexion angle, the iliotibial band begins to move posterior to the joint axis. That make sense? Okay. With the pivot shift maneuver, the subluxation phenomenon occurs due to action of the iliotibial band reducing the tibia back in its correct position. So basically, let me talk through it a little bit and see if this makes sense. So the patient's going to be supine. I'm going to abduct the hip a little bit, okay, slightly. I'm going to immediately rotate the hip. I'm going to grab the heel. All right, I'm going to lift. I don't know if you can see this. We might need to zoom out a little. Okay. All right, and so I've got the leg here. All right, and what I'm going to do is I'm going to compress. I'm going to axial load, and I'm going to create, with this hand, I'm going to create a valgus force, okay, against the fibula and the lateral gastroc. And so I'm going to load it. In this position, because the iliotibial band is anterior to the joint, if his ACL is gone, I basically have him subluxed here. And what happens is when I bring him up into flexion, Brian, you all right?
Yeah, it's my ankle.
Oh, okay. I'm just going to bring him up, and what will happen is when I get him towards flexion, as his iliotibial band moves posterior, it's connected to the tibia, right? At Gerdy's tubercle. It's going to slam it back down, and that's the subluxation phenomenon. Okay, and this is called the pivot shift. Okay, so medial rotation, I'm going to put a valgus stress at the knee, and I'm just going to bring him up through this 30, 40 degrees. And what you'll see is when he comes up, you're going to see the tibia is going to want to slam back and sublux, or fall back into place. Here it's subluxed, and as I move him up, the iliotibial band is going to pull it back. Now this is a very difficult test when patients are awake, especially those that have instability, because they'll guard. But they'll do this a lot right before surgery for an ACL reconstruction, to elicit this pivot shift. It's a pretty important confirmation test. Okay? So when the patient's totally relaxed, it's pretty easy to do. But when they're awake, it's a tough test to do normally.
So do you kind of maintain that valgus force as you're pressing?
Yeah, exactly. So just some medial rotation of the leg, valgus force, okay? And then right as I come up through this maneuver, right up to here, he'll sublux, he'll slam back as I get into about 30 to 40 degrees of knee flexion. So he's actually subluxed here if it's torn, and then it slams back. And that's what people say when my knee gave out. My knee gave out. I'll be running, my knee will be subluxed here, and then I'll turn and rotate, the iliotibial band will slam everything back. Boom. So when they feel their knee give out, it's probably already subluxed, and that feeling of it going out is actually coming back. It's kind of weird. But that's what happens. Questions about it? You can try it. It's difficult. We're not going to hold you responsible for this test on the practical, but I would like you to try it, okay? Once again, position. Patient's relaxed.